Greetings, everyone. I'm Jed Slackman. I work as a mental health counselor as well as a hypnotherapist and energy healer. I refer to my offerings as holistic mental health care. And in this video, I want to speak a little bit about the idea of preventive mental health care, as well as how the modern managed care and insurance constructs tend to obstruct or interfere with people accessing or obtaining preventive mental health support. Some of the implications of that and how you might address that situation if you're seeking support or help. So first I want to refer to a few different phrases or terminologies that are used in this field of mental health care and healthcare in general. One of them is medical necessity, and that's a term that's used by insurance companies to determine if they are going to pay for or cover a healthcare service. So from their point of view, for something to be medically necessary, a person usually would need to be diagnosed with some form of medical condition. So that could be a physical illness or disease or a psychiatric or mental health disorder. So if a person has that diagnosis, then the insurance billing is connected to that diagnosis. So if you were to go to a doctor or a counselor and they're giving you some type of therapy, for that therapy to be covered by the insurance company, the doctor or therapist has to provide that insurance company with some diagnosis that they've given to you in order for your insurance benefits to cover that service. In the mental health field, there's the Diagnostic and Statistical Manual of Mental Disorders, and that connects with clinical diagnostic codes that are provided to insurance companies. If you just go to a therapist and ask them to provide counseling to you, but to not give you any diagnosis, they're likely not going to be able to bill your insurance to cover that service. You would need to be able to pay for the service yourself, since you're not getting a diagnosis to provide the insurance company. As a result of that, people who can only afford care if their insurance is covering it may be limited in their access to care if they don't have symptoms or evidence that would qualify them for receiving the mental health disorder diagnosis. Now, there are actually hundreds of different diagnoses that exist that someone could conceivably be given by a healthcare provider, and just in the context of mental health. So it's actually the norm, in a sense, for a person to receive a diagnosis when they seek out mental health care. Part of that is sort of a bias toward the providers wanting to provide counseling or help to the people that are seeking that form of support. So since the diagnoses are somewhat subjective, there isn't a very rigid standard for whether someone meets criteria or not. It's somewhat based upon the subjective perception or observation of the healthcare provider. There isn't a biological test that determines that someone has a mental disorder. It's really just the reports and observations that are provided. So what the client themselves describes about their own life, their own symptoms, and any observations from other people in their life, from their family or their employer, and any interview or assessment that the healthcare provider is giving to that person to try to assess, do they have any type of so-called mental health disorder? Are they impaired in their functioning in their life in any particular way? So those are some of the means of assessing in order to determine a particular diagnosis for a person. So that kind of calls into question how we collect statistics in the mental health field in terms of people having, quote, anxiety or depression or schizophrenia or ADHD or addictions or any of these phenomena that are labeled with a disorder diagnosis. It could be argued that if we look at the entire population and observe everyone's life, we could find something to label a person with as having some form of phenomena in their life that could be deemed as outside of the norm, as, quote, abnormal or unhealthy in some manner. So if we were to look at health as existing on a continuum between 100% perfectly healthy and the opposite, having a complete lack of health or well-being, no one is 100% on either end of that spectrum or continuum. We're all at various degrees of health or lack of health. So you could scrutinize anyone's life and find something that seems somewhat out of balance, that people are impaired in some way in their ability to function optimally in their life. And as a result of that, anyone who's a clinician who wants to provide a diagnosis to a person seeking psychological or mental health care could find something to provide as a diagnosis to give to an insurance company to enable that person having their psychotherapy covered by the insurance benefits. But there could also be a different bias applied where providers are being much more rigid or stringent about finding someone as having a disorder, and in that case people would be screened out or denied care based upon the insurance not covering someone getting care without a diagnosis. So these are things that are often debated. There are controversies in terms of the healthcare field, in terms of mental health care and insurance, and how these controversies might be addressed in everyday practice. If we think about preventive care, the idea of preventive care is to help people maintain their health, their state of wellness or well-being, so that they don't end up with some type of disease or disorder diagnosis. So in the more physically oriented realms, that would be having people maintain a healthy diet and exercise and lifestyle, so that they prevent getting things like heart disease or diabetes or cancer or any other physical health diseases or diagnoses. Whereas in the mental health realm, we would think of helping people be able to better handle everyday life stresses so that they don't develop clinically diagnosed disorders such as a depressive disorder or an anxiety disorder or an addiction or any other form of mental health diagnosis. So if we want to provide preventive care in terms of physical health, you would think we would want to provide preventive care in the context of mental health so that people are more proactively getting support rather than waiting until things are kind of spiraling in a negative way in their life where they're not able to hold a job or maintain a marriage and so on. Ideally, you would want to offer support and resources to prevent things from getting to a state where someone appears to have that disorder diagnosis. So in terms of that philosophy, it doesn't make sense for insurance companies to deny care, to deny people being able to have counseling unless they have the disorder. You would want to make the preventive care accessible. However, that's not the treatment model that most insurance companies are applying. In most cases, people will not be able to have insurance cover counseling or mental health care unless there is a disorder diagnosis presented. For anyone in the public who is seeking support and can't afford to just cover the cost of care for themselves out of their own pocket, you have to encounter that challenge. If you don't meet criteria for a disorder, how are you going to get that support? And there might be a variety of options that you can access. There might be organizations that provide that care, not working directly with insurance, but receiving funding from some other third-party provider. So there might be some agency or institution in the community that's helping subsidize that type of therapy where it doesn't require someone to have a mental health diagnosis to receive it. There are also many self-help resources that people can access. So not only community organizations or subsidized forms of counseling or support, but there may be community organizations that don't charge people to receive support. There are recovery groups such as AA, where there's no fee to participate in getting those types of services or support. There might be mental health type support groups at a church or spiritual organization. There are also various online support groups, online self-help resources. So there are psychoeducational videos and websites that give people some guidance or resources to help them address their own mental health concerns, where they're not going to a practitioner to be diagnosed and quote-unquote treated for something. They're just getting self-help resources where it doesn't require getting diagnosed and billing an insurance company. So whatever stress or challenge anyone in the public viewing this video might be dealing with, know that there is a path that exists somewhere for you to get the help or resources that you need. So don't quit or give up if you don't see that opportunity appearing right away, right in front of you. You may need to do some searching or investigating, but if you are committed with your intention to get support and help for yourself and improve your life, trust that the path will appear, the resources will come into your field of awareness, probably sooner rather than later, but they are out there somewhere. So I encourage you to be persistent, to really have faith in life and confidence in yourself, to believe in your own value, your own self-worth, to know that you deserve the best resources that exist and that you can find some means to access them. You can advocate for yourself. You can research things in depth, and you can find the best form of support or care to address the concerns that you have in your life. For anyone that is seeking holistic healthcare support, I invite you to visit my website, phinsights.com. That's spelled PHINSIGHTS.com. For now, I want to wish everyone a wonderful day. Namaste.